should be people going through.
Sure.
All right, now you're ready.
Here you are.
Okay, I'm gonna call the meeting to order,
Just
everyone.
back to the beginning.
Let's do a quick introduction, so if anyone's watching the live stream, they know who's here. Harmony, you wanna start?
Hi, I'm Harmony Ayers Friedlander. I'm the Director of Community Services and Deputy Commissioner. Sally McConnell Janae. I'm a member of the Community Services Board and also of the Developmental Disabilities Committee.
Nicole Zulu, Community Service Board member.
Sheila McHenry, member.
Jan Lynch, member.
Mary Hutchins, member.
Randy Brown, liaison with legislature. Travis Winter, member.
Jessica Connor, member and mental health subcommittee member.
Corinne Plazo, administrative assistant. Thank you.
Okay, any additions or deletions to the agenda at this point?
Did we?
I'm sorry, can you go? I always do that, I'm so sorry. Go ahead, Larry, you go next.
Yeah, I'm Larry Roberts. I'm a member of the Community Services Board and the chair of the Mental Health Subcommittee.
Renee?
I'm Renee Spear. I'm the Executive Director for Catholic Charities of Tompkins, Tioga.
And Jake?
Hello, everybody. Jacob Parker Carver. I am the chair of the Substance Use Subcommittee.
Thank you, everyone. Okay, so now are there any additions or deletions to the agenda? Hearing none, we'll move on to the approval of the minutes from May 2025. Hopefully, folks have had a chance to review them. Do I have a motion to approve? Sheila and Jessica seconds. All in favor? All right, great. Privilege of the floor. Anything in that regard? And then board correspondence or announcements, I'm not aware of any. Thanks, Harmony. So the first item on the agenda is for Renee Spear to talk about the Catholic Charities A Place to Stay and give us an update about that service and how it's going.
All right, thank you. So first of all, Catholic Charities also provides other services such as emergency assistance, SNAP, immigration, fatherhood, employment, and services through the Office for People with Developmental Disabilities. Housing services, we have 2 transitional homes, one for men, one for women, and we have 14 scattered site apartments for individuals with substance disorder or mental health. We also provide like security deposit and rental assistance to try to help keep people in their homes and not become homeless. And soon, hopefully in 2026, long awaited, we have an ESHI grant for 22 units for a new development that's being built on State Street. And that will be for domestic violence and mental health. So hopefully we can get that going. Another big thing too, though, is we've always have seen that we definitely know that in order to assist each person towards self-sufficiency, it takes a coordinated effort with other resources in the county. So we work closely with other housing providers, such as Ithaca Neighborhood Services, TC Action, Human Service Coalition, Department of Social Services, Tompkins Whole Health, as well as like the local SPOA, Continuum of Care, Coordinated Entry, outreach workers, jail reentry, and others. So working as a full community allows for the best service for everybody. And that's kind of how it came about. And the reason I kind of give a little bit of that, because that's how it came about, applying and being in a larger partnership with Tompkins County Whole Health on the grant, the RFP that came out for doing housing services. So what we had seen since we've been doing A Place to Stay, we opened up our first transitional house for women in 2016. That really was the first time that we really engaged, Catholic Charities really engaged in actually doing that type of housing services. And we did it because we saw that there was a gap for women that were homeless in the county. And we have kind of, some funding that we have had with that house, but struggled to keep it financially stable and keep it going. But we found that it was very important. Majority of the women that came to the house were dealing with substance use. And what we liked, though, is that we had types of funding such as NISHIP or IURA or the Human Service Coalition, United Way, to help us run this house, but it could be flexible. It didn't have all these strings and contingencies from some of the other kind of grants that you could get for housing. And so when the RFP came out for the one through Tompkins County Whole Health, it really appealed to us because we could continue with our women's home, but we can expand it into other services, and we could develop it working with the staff from the Whole Health to be flexible. And that was a key, so that individuals, we could base the services really around what the individuals really needed, and really come up with good services that didn't really hold us to a lot of strings on the funding. And it's been a great partnership. A lot of challenging situations come about, and we could talk those challenges over with staff, Harmony and her staff, and we could just be flexible. So we opened up a second transitional house for men, and then we have some scattered site apartments. And then we do have other scattered site apartments through the Office for Mental Health. So we can really look at it as individuals could start out in a transitional house. Maybe that's where they need it, and they can get, high intensive case management. And they might need to start there, and then they could go into one of the scattered site apartments, and then into their own permanent apartment. Some of the other funding mechanisms that you have do not allow that, because they don't see transitional homes as being homeless for somebody. So it makes it a little bit harder to do kind of like a stepping stone for somebody. But with this funding, we can do that kind of stuff. We can have someone start there, or if somebody is ready, they could start right in one of the scattered sites and then work themselves into their own permanent place. So the flexibility and the partnership has really made this program flourish so far. I really like how it's going and how we're all working together, and we're doing the best services for each individual. So what we wanted to see out of this program is some of the program goals. We wanted rapid entry into housing. Getting into a house is one of the first steps. We have to help people to get into a house, and then we can help work on some other things. So rapid entry into housing. We wanted enriched supportive services that would build trusting and therapeutic relationships necessary for the healing and the recovery. And we wanted to develop skills needed for independence over time. We also wanted the program designed to be low barrier, housing first approach. No requirements for like treatment, a clean criminal record, a diagnosis. We do know that they had been dealing with some substance use concerns. We wanted intensive supports during the transition from living unsheltered. And so intensive case management, peer support, residential assistance. We wanted it to be housing flexibility tailored to the individual and their current needs and their goals and their level of independence. And so working with Harmony and her team, we've been able to develop the services this way. So since we started, we just opened this it's about a year now. We opened it in June of 2024. So we have served about 18 individuals so far. the length of stay has been about 131 days, a little bit less than what we anticipated, but we're still only a year into this. And individuals so far have been doing really well. Majority of the individuals, about 81% of the individuals that are there, they have been participating in their services, which is really a high percentage with participation of their services. So we're really excited about that. We have about 73 of the individuals that have engaged in employment services, which we do have employment services, so we could do it either through our own services or we can utilize services throughout the community. And we've had about 44% of individuals who are engaging in some type of education, either going for their GED or other types of education programs, which is really exciting as well. So right now, what we're looking at, we have a little bit of a setback right now, and that's because our women's house had been sold. So we are looking for a new home. So if anybody knows of a 3 or 4 bedroom home that was be for rent, please let us know. We've got a couple of ideas of, potential ideas right now, but that kind of set us back a little bit of didn't know that was going to close this quickly. So we do need another home for the women's transitional home. However, we didn't have to, we were able to find other placements with some of the scattered sites in that for individuals who are living there, so nobody lost out on any services. We have had some individuals who have, about 44% of the individuals who have obtained their own permanent housing, which has been really exciting as well. And we can continue to provide case management to individuals, even though they have moved into their own home. As long as they want that, then we'll continue to provide that for at least 6 months, or if need be longer. The other nice thing about this grant is that we can support people for a full year. That's really, really helpful, because a lot of the other funding mechanisms we get, it could be only helping to support people for like 3 to 6 months. So this gives individuals a longer period of time to really get themselves stable and to move on and have us to continue to be working with each individual. So that's kind of where we are right at this point. Are there any questions that anyone might have?
Where do your referrals come from?
So we can get referrals through DSS. We could get referrals through Tompkins Whole Health, SPOA. We can get referrals from other agencies, self-referrals, coordinated entry. So it's a variety of places that we'll receive the referrals for. We do work a lot with coordinated entry.
Thanks for that. Other questions for Renee?
Renee, and maybe Harmony, you can tell me if this is still happening, but the Office of People with Disabilities, they had 4 houses here in Tupps County that were empty. And they might still be empty. They were empty for a year. One's on Aurora Street, and that one's got to have 4 or 5 apartments in it. It's been empty for over a year, maybe 2 years now. It's a nice house. And there's one down by Willow Ave. So there are houses that I know Corso Kumpfi did speak to the office. It's old
PWD.
Oh, PWDD.
And they were interested in ideas that the county may have for using them. So, but they were in very good condition, these homes. And the reason is because they moved people out to larger facilities.
Oh, that's really good information to know. So who would be the contact to look into those?
I know Corsa spoke directly to them
I
about it.
could link you with the Deputy Commissioner Vanessa Smith. Do you know Vanessa Smith?
I do.
I just spoke with her about last week. About some other program closures, so I'll give you an update on that. So it's really concerning what's happening in terms of housing for OPWDD, but I know they said in that meeting I had with them last week, they want to at some point reopen, because these are state programs which pay even better than, you know, the nonprofit programs, but until that time, that may be a good option.
Hmm. Yeah, any ideas would be helpful. That would be wonderful.
Yeah, I think you could just say that we spoke about this and that it was mentioned that the new county administrator has spoken probably to Vincent, I'm guessing, because he's the commissioner for our region, Region 2, so.
Okay, thank you.
And
Wonderful to see something used, so it's just sitting there.
Oh,
Yeah.
Claire.
They just-
Larry?
Yeah.
Larry?
I have two things. One is to say, maybe working with INHS would be a good way to find a house or set up apartments. I don't know what their vacancy rate is, but they work a lot with people who have significant disabilities. And I was wondering if you could sort of summarize sort of the history of the people who come into this housing. Are they people who have been homeless for a long period of time, or are they, what's their relationship to homelessness?
Yeah, that's a great question. So, with this funding, we are supporting individuals who are struggling with substance use.
Okay.
So it's a variety. Some individuals have been homeless, some have been in and out of rehabs for a long time, some are coming out of jail. I mean, it's a variety of situations.
Thanks.
Yeah, great question though. And with INHS, Larry, too, we do work very closely with them on any type of vacancies, but great, good, also good suggestion. Thanks.
Yeah. They're a great agency.
They are.
Experience.
Yes.
Any
Please
other
put in
questions?
I said INHS is a great agency because they're my landlord. So the more we have, the better.
Yes. I do want to say though that what I really like about having the funding that we have now, and that is that the collaboration with Tompkins County Whole Health and Catholic Charities, and that like we work really well together, and we've had already some very challenging cases, and it's just really nice to be able to get on like a Teams or a Zoom or whatever and just talk these cases over and hear other people's expertise. It's really, really helpful to do that. And then Harmony will even be able to make other kinds of contacts for us to get us some other ideas and suggestions of how to really help people that are very challenging that maybe we haven't thought about in ways that we could help somebody. So partnering like that and then reaching out to other sources, I really think that is the goal. That is a big goal to do to really support some of the challenges and to really help individuals. Because we're not the expertise always and different things. So utilizing everybody's expertise has just been wonderful. I'm really appreciative of it.
And I would just add, like, your staff go above and beyond for people, and that's what makes this program really work, is that you take, when Larry's asking what kinds of people are in this service, we really designed this program with our opioid dollars. We spent a lot of time designing it. And we picked the things that we thought would make it work, like the length of time that people could be in it, and making sure it was really robust with support from having an intensive case manager, old school intensive case manager, small caseload. And then you added the residential staff support along with the peer support. So people really get a lot of help. But your staffs have an attitude of like, everybody deserves respect, dignity, housing, and there's no like judgment of who cannot be in this program, who's not good enough, who's not deserving of it. And they just go at it 100%. So whenever we have these situations, you can just tell like people are trying the best they can for somebody. And that's why I think, these rates of people being involved in services are really high. The percentage of people already permanently housed, that's when we're talking about people who have been in and out of jail, who've been in and out of rehab programs, who've had lots of failure, that they're experiencing that success. I think that that's pretty incredible result. So it gives us, I hope in the future, Oasis looks at these programs and says, oh, if we just give counties money and tell them, go figure out what you need, instead of designing, like you're saying, the programs that have so many loopholes and things, and everyone's got to do this one thing. Well, not everybody needs this one thing. Let counties design programs that meet the needs of the people in their county. I hope they get a lot of success from the way they've done this with the opioid settlement dollars, that in the future they say, oh, people can do really big things that work locally. Like this program's more robust than the state's SOS program. It's like in your tier of services, because they do SOS housing too, that the state just released. This program takes people that have more challenges than that program, or because it is more intensive support. Because in that model, the outreach worker is also the caseworker. So are you doing outreach today and helping other people that you're bringing, that are homeless? Are you help outreach worker? Or are you a caseworker for somebody today? Which job are you gonna have? How many hats can you wear, So I think that the intensity is what was really helpful. And then you're able to hire people who are really committed to helping people, so.
Harmony, are you working with the state or communicating this with the state about, what you were just saying?
I think they're learning that from the model, because they had to slow down the number of people they were outreaching, because they also are getting people into housing, which is excellent. I am really excited about them. I'm not downplaying that model. I think it's a great model. But when we designed this one, we really wanted to make sure it had like a more intensity of support up front, so the jobs weren't like split into other things you might have to do. And I think the counties or the state is looking like, how many things can we do with a pot of money, And sometimes I think you save money in the long run when you put a lot of money, when you put what the resources really need to be to a thing, just spend it up front. You're going to spend it anyways. You're going to spend it in the prison, you're going to spend it in the jail. You're going to spend it in multiple other ways. Failed times people go through services that they would have been successful if they had more support.
I think that's absolutely correct, Harmony. I think when individuals come out of rehab or jail or whatever, and they're trying to maintain their sobriety, that's tough. You're coming out, you get into a house, and now all of a sudden you're thrown back into the community, and you got to, you got to make it. Well, how do you do that without a lot of supports? It's very difficult. So I like the way this is, because we can give that. We can give a lot of supports. Not everybody wants that much support, but we can base it on person-centered. How much does somebody want? But at least they know we're there. And Harmony, thank you very much for those kind words.
Okay, well, thank you for all that information. Are there any final questions before we move on to Jake's information? Thank you again. That was really helpful to hear how things are going.
You're welcome. Thank you. If there's no other questions, then I'm going to leave you guys to your meeting.
Thank you.
All right. Bye, everybody.
Bye.
Thank you.
Thank you.
Okay, so Jacob Parker Carver is here to talk about the substance use disorder subcommittee. As you all remember, we're hearing from one of the subcommittees at every meeting. So it's about 3 to 4 times a year. And he's gonna just tell us what they've been talking about and whatever issues or challenges or good things that they see happening. You're on, Jake.
Thank you so much for that introduction. Happy to be here, folks. Good to see you all. Because this is my first time presenting to the committee, I thought that I'd do a brief intro and then an overview of the progress we've made towards the local services plan, and then potentially go deeper into specific topics at future meetings. I believe it's set up for me to be able to share a PowerPoint. Would that be okay if I do that in a moment? Okay. I'm a big fan of PowerPoints. So firstly, I want to say that I am a person in addiction recovery. Formerly, I am a New York State certified peer specialist and also a certified instructor through the Recovery Coach Academy. I am also a licensed clinical social worker and
So
currently
you know you haven't shared your screen yet.
I was going to do that right after I
Okay,
introduce
sorry.
myself. Thank you for the reminder, though. I appreciate that. Currently, I am the Alcohol and Other Drug Services Coordinator for Cornell Health's Counseling and Psychological Services. I have the privilege of working with Travis. Hi, Travis. I became one of the co-chairs of the Substance Use Subcommittee in spring 2022. I think of things in terms of semesters since I started working for Cornell. Please forgive me. I took over, or I joined the Substance Use Subcommittee in spring 2022. I took over as one of the co-chairs along with Marley Brooks in spring 2023, and then she left as co-chair in fall of 2024, and I've been the solo chair since. And now I will go ahead and share my screen. Can everybody see that PowerPoint?
Yes.
Okay, excellent. What I'm sharing with you today is a PowerPoint that I put together to help orient new members to the Substance Use Subcommittee. So it's a breakdown of the local services plan, goals, and objectives. I imagine many of you are pretty familiar with this, so I'll breeze through the initial breakdown of each of the goals. This illustrates the objectives that the Substance Use Subcommittee is not directly responsible for, but more importantly, here are the objectives under each goal that we are responsible for, broken down further by the deadline year, 2024, 2025, and 2026.
Can that be any bigger? I can't read it.
Can it be any bigger?
If you switch to, to showing it, actually show the
Presentation. Yeah, view presentation.
View.
I mean, since you're
There you
not
go.
reading
Is that any bigger?
Yeah.
Thank
Is
you.
is that legible now?
Yes.
Okay, fantastic. I think the rest is bigger, so bear with me. So this is what we worked on in 2024. This is what we're working on in 2025, and this is what we will be working on in 2026. So how did we do last year? For the goal of the workforce shortage, the second objective, understanding the scope of the workforce shortage, we put effort into developing a survey to measure the workforce shortage that was completed by agencies receiving county and state pass-through dollars. That survey also serves to satisfy objective 3, where we wanted to quantify the impact of the workforce shortage on service delivery. So that was a project for a couple meetings last year, and spoiler, later I'll be talking about the results of that survey that we got to hear at the beginning of this year. For housing, my understanding is that a representative from the continuum of care presented data collected on disability and homelessness and discussed the interaction between the two during a community services board meeting in 2024. And we also used the workforce shortage survey to collect information about housing reductions. So those were the conversations we had specifically relating to the goals and objectives. I'll also reference that last year we had a couple meetings pertaining to the closure of the Alcohol and Drug Council, which was a big blow to our community. And we also had a couple meetings talking with Frank Krupa about the potential to form an opioid task force. Plans for that still in the works. Then moving ahead to 2025, some of these are proposed ways of meeting these objectives. Part of them are in progress already. We want to highlight the severity of the workforce crisis by participating in advocacy efforts. We collected some really good data. Surprising, I don't think anyone, the workforce shortage survey showed us that the issue is in fact severe. There's a lot of really difficult work being done in a community where the rates of reimbursement are on par with other rural communities, but the cost of living for people in the workforce is really high, which presents some barriers. And also just the landscape of substance use and related crises is ever escalating and evolving. We had a good meeting in March of this year where we got those survey results and talked about some plans for advocacy efforts. We want to further support workforce diversity, and we intend to add questions about DEIB initiatives to the workforce shortage survey for when it's administered again this coming year. For the second goal, housing, fourth objective, advocacy for housing solutions, we want to clarify our role and commitment in addressing housing, review and evaluate data on housing reductions, identify needs, and provide a summary to local and state leadership. We're also trying to encourage our subcommittee members to participate in housing discussions conducted by the Human Services Coalition. We had folks from Catholic Charities of Cortland present on their SOS services at a meeting in February, which was also informative and helpful. Although they are Catholic Charities of Cortland, they do provide relevant services in Tompkins. For identifying best practice crisis response across the mental hygiene system, we hope to invite presenters from current and novel piloted programs in Tompkins County and guests from other counties to share their approaches. This is also relevant to the SOS presentation that we had this year already. And we hope to hear from the Tompkins County Sheriff's Program and the CARE team at some point this year as well. We want to expand access to crisis supports, ensuring that 211 has updated information on emergency and non-emergency resources available to the community, and develop a public service announcement through Whole Health. For the fourth goal of cross-system services, we want to improve public awareness of available services across systems, consider strategies that improve collaboration with school districts, community supports, and mental health service providers. TBD. We want to improve coordination of services across mental hygiene system. We may continue working on this objective through 2026 rather than limit it to 2025. But we did hear some good news from Reach Medical in a presentation in March about their outreach program that I'm really excited about. We want to use opioid overdose data to guide interventions across the mental hygiene system. And there's been a lot of good work on this, publishing comprehensive data on the Whole Health website, exploring partnerships with CMC and outreach and treatment providers to make use of the data. There was a meeting of Narcan providers locally about their distribution practices, and they are continuing to meet ongoing. And as I referenced earlier, we're going to have continued conversations about the potential for the formation of an opioid task force. And the last goal, transition age youth services. We want to ensure availability of effective substance use prevention services for transition age youth. BOCES is a great partner for prevention services. ADC was formerly providing prevention services in local schools, and that contract has since been taken over by the Rural Health Institute, who we hope to hear more from later this year. Back in April, we had Ashley Dixon present to us from TC3 on their collegiate recovery program, and the SERPA trainings that they have offered historically. Also, not specifically related to the goals and objectives that the Substance Use Subcommittee is responsible for, but we are invested in advocacy for expansion of peer services. In the May meeting, we had a great conversation with a whole bunch of peers representing a bunch of different agencies and peers in different contexts. We recognize that there's a lot of differences in the certifications that are required for different peers, different identities that are represented or not represented by different certifications, most notably the difference between a peer specialist representing someone with a lived experience in the context of mental health versus recovery peer advocate being someone who has a lived experience in the context of substance use issues. So we had a whole big group of peers together to hash that out and talk about ways that they're able to support each other. And I think that takes me to the end of my slide. I hope that was helpful. I am notorious for putting too much information in slides. I apologize if I've done that again, but wanted to get you the valuable information. Are there any questions?
Jessica?
Do folks from the like substance treatment courts come to the meetings?
Periodically, not in a regular ongoing basis, but I would say especially in May, the conversation with peers, many of the peers who came are regularly involved in the treatment courts. So short answer, yes, sometimes.
I have a question. I don't know if this has changed, but I was told at one point that Narcan is not allowed in schools. Is that still true? Because I was told that at BOCES, a student had laced fentanyl vape that they had to use Narcan on just like a couple weeks ago. Yeah. So that's why I'm like wondering about the need for this in schools as well, because that was life-saving for that youth's life.
That's a great question. My understanding is that they had access to Narcan that was
So
able
they-
to save that
OCs.
student's life.
So the adults, like the staff are allowed to have Narcan.
Okay.
Youth themselves aren't allowed to have.
So
Narcan.
like in Ithaca City schools, the staff can have Narcan.
Correct.
Okay.
Correct. So like
Okay.
school nurses, and
that
like
was
a
not
variety
what
of
information that was told to me, so I'm glad to hear that.
the
Okay.
adults can have the Narcan,
Okay.
but not students.
Like any other medication.
No, that's.
But Narcan won't help with fentanyl anyway.
Okay.
So if Narcan's used and it works, it's because there was opioid. But fentanyl itself is not responsive to that. So that's why it's really deadly. We don't have anything that you can just use. So when I know some people, like you really need more medical training because sometimes you have to give people oxygen, you have to do other things to try and get them medical care that they need. So when Narcan works, it's because of the person used an opioid.
The reason that there's the law that makes students not be allowed to have it is being worked on by Anna Kellis, and there's like a group of local folks who are working on it with her, but it's not a like county-wide decision, unfortunately. Otherwise it would be.
Other questions?
I am so thrilled and still a huge advocate for the distribution of Narcan anywhere and everywhere. And part of what I was referring to earlier with the landscape of substance use issues and related crises continuing to expand and evolve is the other things that are increasingly found in substances that people are using, like the fentanyl, and also xylazine, which I understand to be even harder to undo.
Oh, sorry. Randy had a question.
Yeah, you mentioned about the Alcohol and Drug Council closing last year. I know everybody had to pick up a lot of responsibility. How did that go? And who's picking up all that responsibility and slack, so to speak? And how's
That's a
it-
great question. I will say that our meeting next week, our June meeting, there's going to be presentations from CMC and CARS because they are the ones that took the project over. Last fall, we were trying to get folks to take up the contract. My understanding is that there were some delays in the signing of the contract. The initial estimate was that it would take 6 months from last September for them to be up and running. Obviously, that deadline hasn't been met, but I'm optimistic that we will have that operational soon, and I will have more information next time I'm here, once I've heard from representatives from CARS and CMC.
Thank you.
So other people could attend that if they were interested in finding out more.
Yep.
Yeah.
That
When
would be
do you
welcome.
meet again?
Wednesday, June 11th from 12 to 1 over Zoom.
Great, thank you. Other questions? Looks like Jessica has one.
So thinking about the picking up of things from ADC over to CARS, is there any like plan for increased transparency or communication or just ways of, it seemed like the ADC closure caught all of us so off guard. Has there been any talk in the subcommittee about ways to increase transparency?
There's been a lot of talk about a desire for increased transparency and accountability and improvement and expansion of services. This meeting coming up next week is the first time that I will have met the folks who are now in charge of the process. So I have not been part of subsequent conversations demanding transparency because they haven't been functionally up and running yet. But I will say for myself that I definitely want more transparency. And my hope is not just that they will be attending to present at the meeting next week, but I want them to be regular participants.
Well, this is really great information. I'm glad you pulled it together and sorry to wait a little bit, but it was great to hear.
Yeah.
Are there any final questions or is there anything else you'd like to highlight, Jacob?
Anything that I'd like to highlight. This is really difficult, but really rewarding work. I see the real need in our community for integration. Like substance use issues don't happen on their own. Substance use issues are caused by co-occurring mental health issues, by trauma, by homelessness, by all kinds of related things. Addiction doesn't happen in a vacuum. So I very much appreciate collaboration and integration, and I'm happy to see that so many of the goals and objectives for the local services plan are about trying to bridge these gaps. If it's okay, would it be okay if I stayed for the next item on the agenda just because I'm curious?
As I know, it's about the new whole health commissioner.
Mhm.
Very short.
What I have been told is that a candidate has been selected, but they are still in the offering process.
Yeah, and I have an update from Corsa that he
Okay.
wanted me to read.
Yeah, that'd be great.
Are we ready to move on? You all set, Jacob? Yeah, okay. So I'll pass these around too, so that some people find it easier to read. than to just listen to me. But this is from Corsa, the county administrator. It's dated May 27th. He says Tompkins County launched the search for a whole health commissioner in March 2025, waiving county residency requirements for applications to encourage a broad candidate pool. County administration convened a 10-member search panel with representatives from county administration, Tompkins County Legislature, Tompkins County Board of Health, Tompkins County Community Services Board, and department heads. Panel members received training on mitigating bias in interviewing and selection process and committed to utilizing a standardized rubric for each phase of the selection process. A total of 16 applications were received, which we were very happy to see there was a good turnout. And after an initial application screening process conducted by panel members, 7 candidates were invited to a 30-minute initial virtual interview. That's individual interviews. From these interviews, 2 finalist candidates were asked to attend a 1.5-hour in-person interview with the panel, followed by an hour-long Q&A session with selected Whole Health staff on site at the Brown Road location of Whole Health. Each candidate also had an opportunity to visit and briefly speak with staff on site at the Green Street location of Whole Health. Following the conclusion of the in-person interviews, the panel reconvened to deliberate, reviewing all of the candidates' materials and feedback from the interviews and staff Q&A to inform their recommendation. The panel unanimously agreed to recommend Jenny Sutcliffe as the next County Whole Health Commissioner. With an impressive breadth of experience within the New York City Health Department and at various state-level agencies, Jenny brings an enthusiasm and energy for the role and commitment to the continued successful integration of the Department of Whole Health. The county administrator has accepted the panel's recommendation and has offered the position to Jenny, which she has accepted, which was just for Bridget today that it was accepted. They just don't have a start date yet. And Jenny does live locally, even though she was working on some New York City things, but she was doing that remotely. So she is a local resident and has long-term connections around here. And Mary was on the panel along with me to represent the Community Services Board. And we were very impressed with both of the final candidates, but Jenny did rise a little bit above in terms of her presentation. Is there anything you want to say?
Yeah, it just felt like a really credible process and it felt good to be part of. And I think we came up with a good candidate and I'm so glad to hear she accepted. And
it was a great process and it was particularly refreshing after the way the last choice was made. No, meaning nothing against Frank, but there was not a process for that to happen. That was just all kind of a messy situation, unfortunately. But now this time it was a very clear and planned process that was very fair.
yeah, and I think the group worked well together and really appreciated Corsa's involvement too.
Yeah.
Is there any idea about when she might start? No, it's all.
No, that the email today said there's not a start date yet. Maybe by next month I'll hear, or somebody will hear something. Yeah, Larry.
Can we get some basic information about her? Like, can we see her resume and what she is bringing to the position?
Yeah, I'll check with HR at the county level before I commit to saying I can pass it around. But if they say it's okay, then yeah, I can have Harmony or Karan send it.
Yeah, just, whatever background information so that we know who she is and what she brings. And I also wanted to say, I think people need to know that Jen particularly, but other members of the Community Services Board pushed this time to make sure that the mental health and substance abuse and developmental disabilities programs that we're responsible for were very much part of the discussion and part of the outreach to candidates that was done. And I feel pretty confident that that our issues were dealt with effectively. And I wanted to just thank Jan particularly for, making that happen.
Thanks, Larry. I think there was a group effort. And at first, it seemed a little bit like maybe we weren't getting our message across with Corsa, and then there seemed to be kind of a breakthrough. And from there on in, it felt like you really understood the importance of what we were trying to communicate. And that felt really good.
Great.
Anybody else have comments or questions? Okay, I'll check on that one thing then. Did everybody get a copy that wanted one? Yes, okay, so the next thing on the agenda is an executive session. This has to do with membership. And, oh yeah, Randy will have to leave.
Thank you for doing that, all the interviews. I know it's a lot of work. Because you have all those interviews, you have to do a rubric and
Oh, yeah,
you have to do the bias training, so it's a lot of work, so thank you for doing that.
yeah.
And you have to do your schedule and everybody's gotta be there, and so,
It was, Bridget was great about, getting organizing all of that, and that was helpful too. but-
We're doing a solar panel for the Department of Social Service Commission,
Oh,
so that's happening right now as well, so.
oh, cool,
So hopefully that goes well.
great, yeah, I hope it goes well for you. All right, anybody else have to leave? I guess not. Dris.
Well, can I actually ask a question? I heard,
Did we turn this on? Oh, we did.
Anybody motion?
I think. What was Larry, what is it have to?
it doesn't have to do with the executive session, but Randy's mention of the Department of Social Services search. Are people from Whole Health on that search committee, either staff or other people?
I don't know that. Harmony, do you know?
I know HSCs.
No, I don't know. Have you heard about anyone being asked to be on that?
It would seem to me that having somebody from Tompkins Whole Health as a allied agency would be really important.
Yeah, that's a good point. I actually kind of lost track of where we were with that particular search because I was so focused on the other one, so I didn't even think of it.
So
Anything
could you ask Corsa if there is somebody and where they are, and ask if we can suggest one or two people?
Whole Health, right?
Yeah.
Whole Health or from the board? Pardon me? From Whole Health or from the board? It is set up. I think he said Whole Health. Okay, can we have a motion to go into executive session? Sheila, Travis, all in favor? An executive session. Okay, so Mary has.
Yeah, so we have three applications we'd like to present tonight. And maybe we'll start with Stu. Would you want to start? We have Julie Carmalt, who I think you have a